Hello, my name is Shannon Scott. I'm a registered nurse. I'm the clinical nurse educator for maternal child health. And today we're going to talk about communication and HRO principles and how they apply to your role as a charge nurse. So ultimately, communication is one of your number one roles and responsibilities when you're in a leadership position managing your unit through the role of charge nurse. And there are multiple ways of communicating. There is the obvious of language, right? When we discuss with one another, what is the assignment? What is the concern? What's happening next? There is communication on the whiteboards. There's communication between patients, between one another, and amongst the different parts of our units. For example, our physician team, our PCT team, our EVS team, and other departments. We recognize that communication is all of these different roles and all these different ways and methods. Joint Commission has recognized that a communication breakdown is one of the number one reasons for sentinel events, meaning patient harm, morbidity, mortality. And as charge nurses, as I've said, one of your number one roles and responsibilities is to be sure that you're communicating effectively with your team. And that means not only imparting information to them, but being an effective receiver of communication. This is how we make sure that we provide safe patient care, that we hand off between providers and between shifts. Multiple things can be barriers to effective communication. One of those being information overload, when the unit is busy, when it feels chaotic, when we have multiple different providers changing hands to another shift. If we have a complex organization, for example, someplace like the emergency room, where we have a lot of mobility in our patients. Some patients are coming, arriving, triaging, leaving. Other patients are coming, triaging, and moving to go to other parts of our hospital. We may have competing and changing priorities or constraints. We may have persons who are not communicating effectively in the moment, even though they may possess every opportunity and every good skill to communicate well with us. We may have a mismatch between our method, our timing, the situation, where sometimes the message is important, but the timing of that message is causing a problem for the receiver. There's always cultural gender biases and differences that we need to take into consideration. And we may have inconsistent communication. For example, what someone says versus what they do. Excuse me. We have, be mindful that your communication is not only verbal, but it's also in your body language, your presence, the way you choose your words, and the way you receive others' communication. So how can you be an effective communicator, and what can you do to promote great communication? Well, the first thing is use clear, precise language. Be sure that you are using something that is not jargon. Be sure that you're using professional, respectful language. Make sure that you are very clear if you are conveying something that is a change in priority or that is an urgent matter. Say that right up front. Organize what you have to say into the typical S-bar format when you're trying to express urgency, concern, or a changing condition. Organize your verbiage in IPASS format when you are completing a transition of care from one person to another, from one shift to another. Make sure that you're watching your receiver's perceptions, their awareness and emotions behind what you're saying, and their awareness and emotions behind what they're receiving. Ask for clarification and feedback. Any questions about what I've had to say? Does that make sense? Or this is a change from what I got this morning, so I want to be sure that you recognize that it's really been a different situation since you've been here, or we have a new workflow I want to make sure is clear for you, or we have a new person on the unit that hasn't been here before. It's the time when we are promoting safety, promoting effectiveness, and making sure that the care plan, not only for that patient, but for the status of the unit, is being effectively transmitted between one shift, one caregiver to the next. Lots of different types of communication. We've mentioned this before. There's nonverbal, visibility, and your presentation. There's verbal, clear, succinct communication, professional, polite communication, and very transparent, so that what I'm telling you, what I'm giving you, generates more answers than questions. I should be communicating effectively that I answer your questions based on what I'm telling you rather than generating more. And I should be receptive to recognizing when my receiver needs to clarify for me or has questions about the way I've worded something, what I've said, or what I haven't said. And then, of course, this is another way of HRO communication is our electronic charting. We want to make sure that our charting is thorough, timely, routine, factual, and it's very professional. This is how people who may have never had the opportunity to meet us or to meet our patient have the opportunity to contribute to that patient's care in an effective and safe way. I may be requesting a consultation from someone in the community. I may be promoting follow-up. I may be asking for some unusual connection that my department doesn't typically use, but is appropriate for the patient at that time. The charge nurse role is to make sure that the documentation is upfront and clear so that anyone else who is trying to obtain information through the chart to assist in patient care can do so with minimal disruption, minimal confusion. When you're the charge nurse, one of the things that's helpful to do is to take a look at the communication board in Epic. Make sure that you recognize patients of high risk, maybe a high fall risk, high hemorrhage risk, high sepsis risk. Make sure that you are looking in the documentation of the charts of your patients and your nurses to be sure that anything that is required documentation is complete within the 24 hours of admission, that any of your policies and any of your order sets that need recognition, that need documentation, that need completion are obvious and ready for the rest of the team. That doesn't mean that you know every chart intimately, but it means that you are one of the stopgaps to make sure that whoever is going to be caring for the patient outside of the bedside nurse has easy access to all the information that is appropriate for that patient and that care plan. Only the person who's documenting has that information in their head. So until it actually makes it into the chart is once it becomes part of the HRO, or high reliability organization style. We're going to talk about that a little bit later in the presentation. So what are your responsibilities as a charge nurse, specifically in terms of communication? Well, we communicate in lots of different ways. We communicate upward, right, by escalating a problem to the manager, to the A&M, to the house supervisor. We communicate downward as we share responsibilities and delegate responsibilities, not necessarily downward, but to other scopes of practice, like asking our PCTs to gather information or to assist with patient care, to our EVS team when we need to have a room prepared and ready so that we're able to accept another admission, horizontally to other departments who may or may not be receiving that patient or who may be assisting in consultations, and diagonal, for example, when we talk to someone outside the community or in a different field altogether to say, this patient has an adjunct need. For example, maybe this patient is also lactating, and so she needs an opportunity to get access to a breast pump, or perhaps this patient has some outside management with an endocrinologist, and that's not something that your unit is used to dealing with. So finding out where else are we needing to assist with patient navigation. More personally, the charge nurse is going to be responsible for report. That means receiving charge nurse report from the previous charge nurse of the shift ahead of you. And that includes things like unusual occurrences, sentinel events, links that have been placed and that also need following up. Reports from staff so that you can understand what's happening in these different patient rooms. That will help you determine if you have the right combination of assignment and the right skill set of needs of that patient to the right skill set capability of the nurse. And then you need to be able to give charge report to the oncoming charge nurse so that you can gather up all this information, collect it, organize it, and present it in a understandable and effective way to the oncoming charge at the end of your shift. It is also your responsibility to communicate assignments, and that means recognizing if the assignment is the right assignment for the right nurse and the right assignment based on the other patients that are assigned to that nurse. So if we have an especially high acuity collection of patients in one assignment, can we reassign that to help even out the acuity for that nurse? Or even if we have a very time-consuming item or task expected for a patient, can we make sure that there are other opportunities to delegate that out helpfully, so that not any one nurse is completely at the bedside nonstop while the other nurse is able to finish tasks, document, and move on to other items? It is part of your role to be on the lookout for a nurse who is overwhelmed with her assignment or who is able and ready to accept a delegation or to assist with other items on the task or on the unit. You're also responsible for rounding, not just with your team, but also if you have a patient assignment. You are responsible for assisting with team member coverage. That means making sure that if you have a call out, that you are recognizing and planning for what those needs are going to be for the oncoming shift, as well as the shift you're in. And it means making sure that you have appropriate team member coverage for things like lunch breaks. And if you have somebody who's going to be in a room for a while, knowing that that nurse is going to be unavailable so that you're listening out for her call bells. Units, transfers and discharges. So you're also responsible to recognize if you're having a transfer or a discharge to your unit so that you can keep track of the census for your unit and determine, of course, if you're going to need more staff unit coverage, if you need to staff down, calling and notifying the supervisor if you're getting particularly busy so that you have an appropriate acuity ratio. You are responsible for communicating your concerns to your nurse manager and administrative supervisor and really utilizing that chain of command or consultation. Please feel confident and comfortable recognizing that's one of your greatest strengths and support as a charge nurse is to go to your charge nurse, as a charge nurse, go to your manager, go to your supervisor and say, I have this situation happening right now. This is how we responded, and this is what we're waiting for next. I'm keeping you informed, or I need your advice, or how would you suggest I handle the next step? Your nurse manager will thank you that she didn't find out about this in a meeting or from a phone call elsewhere. She will appreciate that you brought her into the fold and let her know what was going on the unit, because she, of course, is expected to know when there's a sentinel or concerning or high risk event happening on her unit. She needs to be able to speak for that, answer for that, and he'll be responsible for giving that information to the nurse super or for overseeing the outcome of that situation. And like I said, also communicating with leadership about your needs. There are multiple different communication styles, right? So let's talk about this for a moment. You're the charge nurse on a busy shift. A new admission is expected. How are you going to tell a nurse on your team that the new admission is going to be her patient? Well, there's 3 different options for this. First, we're going to talk about passive. This means you just write the nurse's name next to the new patient room number, right? Without telling her this is what's happening or just giving you a heads up. No, instead you just give her the paperwork, you just hand her the chart and said, well, your new patient's almost here. This is not ideal. This promotes a lot of frustration. It's poor communication. It is not an HRO style level of teamwork. And if you're a charge nurse, we just kind of expect a little bit better culture, right? We think about our 5 C's: communication, caring, compassion, connectivity, right? That we really want you to embody that. And the passive style does not display those 5 principles of the HMHCs. So we can also look at the aggressive way, which just says, look, it's a busy day. You've got the next patient. I really can't argue with you about it. If you need help, I'm not available for another hour. You're kind of on your own. Good luck. This also does not promote leadership and teamwork. It does not support your nurse. It does not support the rest of your team. And it's essentially putting patient safety last. Remember that communication reflects patient safety. If we do an effective and good job, a thorough job of communicating with one another, then we are enabling patient safety. So a better way to communicate with a nurse that she's going to be the next receiver of a patient is to do what we call assertive discussion. And that is, as these two are discussing right here, looking through the chart together, they're saying, so I have another patient expected on the unit in about 20 minutes, and I am assigning her to your team today. So I'm going to ask you to be her nurse. This is what I know about her. These are the tasks ahead for her. How can I help you be ready to receive her in about 20 minutes? Have you had lunch? Is there a patient task I can help you with? Is there some documentation in the meantime I can assist you with? What can I do to help you be ready to receive this patient? That's the style we're looking for. That's the model I want you to set. Imagine what it's like when you receive a patient from a charge nurse in your history and in your past. Receive your patient in the same style that you choose to give your patient to someone, right? So you're going to embody all of the hopes that you have in mind about being a charge nurse when you delegate and assign your assignments and your transitions to new patients. Personality of communication, know your audience, be prepared to change that if you needed to. So there is task focused communication, and that means is my receiver a doer or a thinker? And there's relationship focused, and that means am I influencing or am I connecting with my my team? I happen to think that the effective charge nurse is a little bit of all of this and is mindful about all of this. So even if you identify as a task focused doer, please keep in mind that the audience where you give your communication to might be a relationship focused connector, right? So that even if you are coming from a very different place personally when you receive or when you operate at the bedside or throughout your team. As a charge nurse, my expectation for you, the HMH expectation for you, is that you're mindful of all of these items and you put all of these to the test. That means that you're going to talk about what the tasks are for the patients, right? And the tasks for the unit for that day. You're going to do them and you're going to be mindful of the thinker, right? So that means you're going to help them prioritize perhaps. For the doer, you're going to help them by doing another task that might need coverage or that might need assistance while they're doing that task. For the relationship focused person, that means that remember that what you're doing, your presence on the unit, the way you speak, the way you work, the way you finalize any of your actions influences the rest of your team, even if you don't recognize that you are the influencer. You're the leader as the charge nurse. So be mindful that you are the influencer, and you might have other people who are comfortable being the influencer. Use that to your advantage. When you have a team member who is an experienced nurse, who is used to precepting, used to explaining a policy or demonstrating a procedure, use her expertise. It's one of the HRO principles. Say, hey, you know what? We haven't given blood in a long time, but you know who's very, very good at this is, you know, Sharon. And we're going to ask Sharon to pull the policy and to come and be your second sign in for this. And I'm going to watch Sharon's patient for a little bit while she finishes this task with you. And ultimately, through all of these tasks and through being mindful about managing all of this together, you're going to generate high morale on your unit. You're going to end up being a connector of these patients and their tasks. So that means that I am making sure that people who work together get a chance to work together well. I don't just want somebody operating in a silo, but we have to take a pause and we have to communicate and connect with one another to say, these are the things I've accomplished and the things I have coming up next. I haven't eaten lunch. Is there someone who can cover that for me? Or I'm the one who has the next patient coming, but not for 40 minutes. I have a little bit of time where I can help. If you need to catch up on charting, I can go round on your patients, or I can do this next set of vitals for you. You ultimately connect and offer and generate high morale to your patients and to your nurses when you are mindful of all of these items, regardless of your communication style. So effective communication ultimately generates patient safety. We've talked about this. Again, when we leave out communication, when we rush through communication, or when we don't take the time to clarify something, that's when patient safety is at risk. Be aware that when you are afraid a physician's going to shout at you, and so you don't clarify, don't call a patient's doctor, or don't take the time to wade through confusing or conflicting documentation, or missing documentation, you're ultimately putting patient safety at risk. Make the call, ask for the clarification, take the time to get it thorough and right and timely, so that everyone else who follows in the footsteps behind you can benefit from that as they provide care to the patient. Effective communication produces quality teamwork, so that we all get our work done together. Ultimately, we can clock out and leave together feeling like we did well. We generate trust in the work setting. We create successes in our patient goals, and ultimately in staff retention, which saves a lot of money. And when the hospital can save money, we can generate funds into other areas to have a better, higher quality place to provide patient care, and to provide a high quality place for us to work and thrive in as well. You also get buy-in from your team. So buy-in means that your team is connected to your leadership style and says, yeah, I want to do this. I'm part of this. I agree with this. You've got my commitment. When I communicate well with someone and I say, this is why we're doing this, or this is why the workflow changed, or I want you to integrate this new piece of equipment today in this patient's care, and this is why, you offer buy-in from your patient or from your nurse. And what's going to end up happening is that the next time that they have a situation like that, they're going to say, hey, you know what? I used this new piece of equipment, or I used this policy, or I used this algorithm, and it really helped me get the work done well and understand this better. And the patient had a great day because of it. And I want to show you how to use it. And all of that together, of course, generates high morale, and everybody wants to work at a great place to work. And high morale is one of the hallmarks of that. So generating quality communication will generate a place where everybody wants to show up and go to work every day. HMH is a high reliability organization. What does that mean? So you've heard HRO. That's what this stands for, high reliability organization. That means that we communicate and perform in a way that everybody has access to that communication and that care plan. That means that we huddle every day. And on a very busy day, I encourage you as a charge nurse to re-huddle, something like 10 minutes at 10 o'clock, right? So that everybody can come to the desk and say, okay, I've passed some meds, I've seen my patients, this is what's happening for my team of patients. And you can update their acuity, update their needs, update the patient flow, what you're expecting to happen during the day. This keeps you situationally aware as a charge nurse, which is what the manager needs from you. It's what the CLC needs from you, and it's what other departments need, so that they can determine where their patient flow and acuity is as well. This is a deliberate, intentional, purposed conversation where we can talk about safety concerns, orders that need to be placed, what's happening next for the patient, or what we're expecting within the next 4 hours, right? This is a shared model and resources that can be assigned to reduce the risk of potential events of harm to patients, families, and the healthcare team. And it might look a little bit different on different units. So You may have every nurse come and give a discussion briefly of each of their patients. You may have each nurse come individually to give you report, and then you create something that you share on the whiteboard with everybody. This might be something where everybody updates it individually on a clipboard, and then the clipboard hangs up so everybody can see what's happening on their unit. But it's important that it happens, that everybody is contributing, that everybody is forthcoming, and that the information is current and really reflects patient safety, not things like statistics or like staffing numbers for the day. That's not what the HRO huddles should be in terms of patient care. The patient care huddles are really about high risk items, high risk concerns, high time commitment concerns, where items that we're really going to need to devote our time and attention and our skill to are recognized by the rest of the team and enabled by the rest of the team. High reliability is the study of organizations and industries like the commercial aviation and nuclear power that operate under hazardous conditions while maintaining high levels of safety over extended periods of time. And that's exactly what hospitals do, right? We operate under hazardous conditions. We have a lot of people coming and going. The sickest people in town are located inside our hospital. We have machines whirring and whizzing. We have policies that help enable us to know what we're supposed to do. But unless we talk about it with one another, we have it documented somewhere, we have it discussed, understood, and transparent with one another, we may not always know what's happening, right? So it's important that we all operate under high reliability philosophies together to enable best communication and patient safety. Consistency is the key. When it comes to daily huddles, make sure it happens every shift, same place, same time. Keep it brief. Problems are assigned owners and a timeline so that we can reconvene by noon, right? Or by 1 o'clock or by the end of the shift. Keep it focused on safety. As I mentioned, we're not going to talk about necessarily who called out, when is our lunch break. That's not going to be part of the huddle. We're talking about patient safety concerns, right? Leadership awareness. For leaders, that means that we need to know what's happening at the front lines, right? Problems are identified and resolved. Early notification of issues, right? So that we're not waiting until the very end of a shift to recognize a problem and do something about it or pass it to the next shift. And we want accountability for safety. A big part of that is transparency. We're going to discuss safety events, and that's going to lead us down the path of zero harm. And a big part of transparency is being willing to say, I made a mistake, or we didn't follow the policy about this, or the order was wrong for this patient, or the order wasn't followed on this patient, or this patient shouldn't be on this unit, should be at a different unit. We have to be able to have these discussions so that we can account for safety for one another, improve the situation for that patient, and create a basis for transparent communication for future patient cases. Harm happens every day. And what we've recognized is that as many as 98,000 people die in hospitals each year. And this was over 20 years ago due to medical errors that could have been prevented. And that's why documentation is important. That's why communication is important. And that's why the timeliness of that is very important, right? Compared to airline fatalities, look at the difference. You're safer on an airplane than you are coming into a hospital. That's why communication is so important. So patient safety events are things like injuries, assessment or treatment delays, deficiencies, which can happen if we're not documenting on time, right? Patient falls, medication errors, days since your last medication, last fall, your last episode, and incident reports, right? Making sure that we're documenting when we have a problem with patient identification, a specimen labeling or handling problem. Employee safety events also include falls, exposure to infectious disease, and that could be things like a needle stick or exposure to a infectious patient without proper PPE, assaults to employees, and maintenance or equipment incidents, for example, a frayed plug or a leaking item, or something that's out of date or isn't safe to use. So there are 5 HRO principles I just want to briefly tell you. And at the core of that is the idea about high reliability means that patient safety is of the utmost importance, that we're transparent with one another, we're honest with one another, and we're all on the same page. And we do that through these 5 principles. Deference to expertise. That means that we require staff at every level to be comfortable sharing the information and their concerns with others, be commended when they do so. You don't have to be the charge nurse to know how to be the charge nurse. You'll find that when you're in charge, there are other nurses who have done this before you, and they are taking a staff assignment for the day. Go to them for their expertise and their assistance, their advice. Utilize their history to your advantage. And you know what? That also generates high morale as well, too. They like not having to be in charge all the time, but they also appreciate being asked about their advice or about their experience, right? Same thing with things like my example for hanging blood. If the nurse who is at bedside for that patient feels like they haven't done this in a while, but there's another nurse on the floor who has, utilize that experience together so that she can support and mentor that nurse through the process, right? Reluctance to simplify is our next principle. It's desirable to simplify things because it's a little bit more digestible, but it is risky to oversimplify things of what's happened or might happen in the future. We have to be able to recognize often subtle differences among safety risks, and that might be the difference between early and late recognition of a problem and then early intervention of a problem, right? So we want to recognize and honor that many of our processes are complex. They involve multiple steps, and if we try to oversimplify, we may be causing a problem. So we can simplify where we can, and we honor and acknowledge a risky problem when it's appropriate. And in that incident, we take the necessary steps to make sure that we have assistance, including being a charge nurse. When you need help, don't oversimplify it. Go to the manager, go to the supervisor for your comfort level, for your assistance, and for advice. The next is sensitivity to operations. So we keep a situational awareness that's important for staff at all levels about potential errors and actual errors to be quickly identified and addressed. We have to maintain a constant awareness by leaders and staff that the care process is that's essential. So this basically means that when you have a problem, you need to make sure that all of the people who are involved in that care know about it. So on my unit, for example, if I have a laboring patient that has a fever, that is going to affect not just notifying her obstetrician, but I also need to notify the nursery team who's going to be present at delivery so that they recognize this baby may be at higher risk for infection or sepsis, which also means I need to notify the neonatologist or the pediatrician as appropriate so that they can know to draw blood cultures and to initiate antibiotics if appropriate for that neonate. Recognizing that one item affects multiple processes within a patient care or a team's care is one of the areas of HRO that's important for communication. The fourth is commitment to resiliency. And that means that we hold people accountable for their actions, but not for flaws in processes or systems. And that's precisely why we have to put in a one link. You are accountable for what you do, but when you follow a process, you follow a policy, you follow an order, and you've asserted your clinical expertise and training with updated guidelines, when something goes wrong, we recognize that it is likely a process problem. And the only way we can talk about that and improve it is if we open up the transparency for that, pull the curtain back. And the way we can do that is by putting in a one link and having communication. Doing that in a huddle, in a safe zone, having an open door policy where nurses can come to you when they're concerned about something, when they have an issue or a worry, that they can come forth and say so, and putting in the one link item when we have a sentinel event or a near miss so that we can shore up our processes. Those are all very important parts of HRO. The final one is preoccupation with failure. That means that we transparently and openly discuss errors and near miss, because we are preoccupied with preventing failure. That means that we need to think about what are the details involved that could possibly go wrong, right? So even though it's sunny outside, I am going to pack an umbrella because it's spring and it could be rainy and I want to be prepared for the worst. It doesn't mean I'm going to open my umbrella and use it, but I've got it available and ready to go. That's essentially what this means, right? So transparency is the key to changing culture. HROs thrive on transparency, managing the unexpected. We need to be able to focus on predicting and eliminating catastrophes other than reacting to them. So if we are preoccupied with failure, we predict and eliminate catastrophes by enabling the details necessary to provide success. You can't do that if you're rushing and you're over focused on any one item. You have to maintain a situational awareness. And essentially that's what HRO helps you do. You manage these 5 principles. That means that you're aware of what's going on throughout the unit with patients and with nurses, with PCTs, with the rest of your physician team, your leadership team, and this enables mindful communication. Once we've done all of this and all of these 5 items, this leads to, as I say, mindfulness communication. We can discover and manage events, and that gives us a highly reliable organization. So anyone who works with these organizations is acutely aware that even small failures can lead to catastrophic adverse outcomes, right? So that's why we come to work ready to be mindful, not preoccupied, not overwhelmed, and not bringing in a filter that will prevent us from enabling these principles. Recognize that one of the places where this can happen is handoff communication, especially when you are receiving handoff communication, and this will happen multiple times throughout your shift as a charge nurse. You want to make sure that you are using a structured format, as I've mentioned before, and use current information. Please open the computer. Give iPass in front of a computer, in front of a patient, so that you can look together through the latest information documented by the previous shift, the previous department, by ancillary staff, by the lab, and then you can also get the patient's input with that, right? And use synthesis, ask questions, clarify with the patient, clarify with the previous shift, clarify with another department. Handoff communication is one of the areas where we really need to enable our 5 HRO principles and ultimately lead to mindfulness. We need to focus our attention purposefully on the present moment, accept it without judgment. And that also means minimizing our interruptions, right? Collective mindfulness example is a naval aircraft carrier, right? This is a very complex item, very expensive item with a lot of complex things happening at once, right? And there's a lot of people involved in making sure it happens. But you know what? That's exactly what it's like for us too, right? Look, here is the ER team, here's the surgical team, here's the med surg team, here's the lab, here's the outpatient infusion, right? Multiple teams come together to work to provide a whole network of care for our patients. And at any one time, we may be relying more heavily on one portion of our care team than another. But by practicing mindful, connective, transparent communication principles of HRO, you're going to be one of the people who makes sure that as the charge nurse, things went well under your watch. Okay, so in summation, I want to give you a few individual tools to help prevent errors and to help support great communication. STAR and mindfulness, right? So thinking about our situations, being uninterrupted and being completely focused in the moment. Stop when you're uncertain. Ask for clarification. Qualify, validate, verify, right? So this is a great brief one where you can validate information that you've been given to verify that it's true so that your next steps are not in error. And then ARCC, right? Ask a question, make a request, voice a concern, use the chain of command, ARCC. report your safety issues and occurrences using one link. This is not a punitive problem. It's a way to open up and create a conversation among persons and departments that may not otherwise get an opportunity to communicate with one another based on what happened, when it happened, who it happened, or the details that need to be communicated with one another, so that that we don't want to oversimplify, right? And that's part of the reason why a one link is helpful, because multiple different people involved in the situation, plus people who weren't involved but who can help improve a process, can communicate with one another and right or wrong, or can write a process so that it's a better process moving forward for patients. So as a charge nurse, this means that when you walk onto the unit, be prepared to be the best communicator you've ever been. Watch for verbal, nonverbal cues. Document well and timely and in a transparent way. What are the assignments? What are the concerns? When are people taking their breaks? How many nurses do we have? How many patients are coming? How many patients are leaving? Recognize people when they need your assistance. Stay visible so that people can find you. When you take on an assignment, make sure that you are visible to the rest of your team, because your nurses are your assignment when you are the charge nurse. And remember to say thank you to your team. I think that's a big way to communicate your gratitude, your acknowledgement of their expertise, your gratefulness for the teamwork. And it's a great way to generate high morale and to feel good about reaching and setting goals with one another. So with all of that being said, I just want to thank you again for taking the Charge Nurse Workshop. We are so thankful to have you as part of the RMC and HMH team. And we're looking forward to helping you hone your skills and become the best charge nurses yet. So thanks again, and happy charge nursing.